afternoon, everyone, and welcome to the first of the GIC's annual public information sessions for 2023. My name is Matt Vino, Executive Director of the Group Insurance Commission. Thank you for joining us. We're looking forward to sharing some important information with you about this year's annual enrollment, the outcome of the procurement of health insurance carriers, as well as some other useful information and resources to you all. We do have CART services available for this session. A link will be posted in the chat function for access. We are also recording this information session and the subsequent two sessions that we will have this week, which will be available on the GIC's YouTube channel. I also want to recognize at the outset 4 group insurance commissioners, members of our oversight board, who are joining in to listen to today's information session. Toby Choate, Anna Seneko, Christy Kleinard, and Rebecca Butler, who's the designee from the Division of Insurance. Thank you all for joining us. So to start, I'd like to review the agenda for today. If we can go to the next slide. So first, we will provide a brief overview of the GIC. Many of you are, of course, familiar with us, so we won't spend a lot of time on that. Then we will walk through the changes coming to the GIC's health insurance and pharmacy benefits as a result of the procurement that our commission voted to approve last fall. Next, we will discuss proposed changes to our health insurance plan design for the coming year for members enrolled in both our active and Medicare plans. And finally, I'll share some information about an additional set of sessions that we are hosting for members in the spring, in March, leading up to annual enrollment. Then, of course, we look forward to responding any questions that you may have. With regard to questions, on the next slide, you'll see you may submit at any time during the presentation questions through the Zoom Q&A function, which is typically at the bottom of your screen. We have members of the GIC staff on hand to answer those questions directly in writing, as many as we can get through. Also in the Q&A function, you'll see those responses. And when we see questions that we think will have a general interest, we will answer them verbally for the benefit of attendees. So this is the way we've handled these sessions in the past, and has worked very well. So the one thing I want to note, if you have a personal or specific question in nature, please utilize the contact form listed on this slide rather than the Q&A function of Zoom, and we'll have a GIC staff member follow up with you after the session. We're not going to be responding here to questions of those sort, personal health coverage questions and the like, so that we can maintain your privacy. So before we jump into the GIC overview, next slide, I want to note at the outset the dates of this year's annual enrollment. As you'll see here, we will hold that. It will open on April the 5th. And close on May the 3rd. Next slide. So I want to encourage everyone to go paperless by registering for the GIC member benefits portal. You can find that on our website at mass.gov/GIC. All state and municipal active employees and retirees with a valid email address now have access to the portal and will be able to use that to update your personal information, to view your benefits 24/7 throughout the year, make changes if you have qualifying events. And then, of course, during annual enrollment in April and into early May, you'll be able to compare your benefit options and actually enroll in coverage. I do want to note that use of the portal is completely voluntary. If you prefer, you can still continue to submit paper forms to us. And as always, feel free to contact the GIC staff directly. So this is it's a quick, easy to use, convenient alternative to some of our legacy ways of interacting with you. So you'll also be able to use the portal to learn more about and register for future member information sessions ahead of annual enrollment and going forward. So it's a good way to stay in touch with us. So I encourage you to check that out. So now I'll move on to the GIC overview. If we can skip right on to slide 7. We always start with the GIC's mission, which is to provide you with high quality and affordable benefits while driving improved health for our members and higher value in the care delivery system across the Commonwealth. So this continues to be the touch point for all that we do. So you'll also see on the next slide, we strive to meet this mission, as you know, through a variety of coverage options, including healthcare, dental, vision, life insurance, and long-term disability benefits. So a full suite of benefits for you through the GIC. Next, we highlight some key data points about the GIC. You've seen this graphic before. We have over 460,000 members, which makes us the largest purchaser of healthcare in the Commonwealth. We are governed by a 17-member commission that I referred to several of our commissioners today who are joining. And we also partner with 918 agencies, including municipalities, regional school districts, and a variety of other state and local agencies. So the next visual is kind of an explanation of how the GIC is funded. Those of you who have joined us before have seen this. It depicts how the GIC is funded, mostly through the Commonwealth of Massachusetts through annual appropriations that funds the lion's share of your benefits. Of course, if you're a city or town employee, the city or town also contributes a portion to your premium. And then, of course, you, our members, fund the remaining portion of that premium if you're an active employee through your payroll deductions and the like. So that's just a general sense of how the GIC is funded. So also in terms of kind of background, I want to note that the GIC's health benefits are financed slightly differently than you may see used elsewhere. So the GIC through the Commonwealth of Massachusetts is self-insured. That means that the Commonwealth pays the employer share of premium for medical claims, and that's regardless of how much is budgeted for those claims. The state, therefore, holds the insurance risk, not our health insurance companies. So if medical claims exceed what the Commonwealth has budgeted, then it's the state that will pay those additional claims. It does not actually impact you, our members. So you have protection from additional costs. As a member, when you receive, as you'll see on the bottom of this slide, when you receive a healthcare service, your doctor sends a bill to the insurance company that in turn pays the doctor. That insurance company then bills the GIC, and we then reimburse that insurance company. So I hope that's helpful just as kind of a little bit of background. So before we move into health insurance premium rates, just a quick reminder that you can submit questions to us at any time during the presentation, again, in the Zoom Q&A function. We'll do our best to answer as many of those as we can and pull out those that we can address verbally for everyone's benefit. And again, if you have a personal or specific detailed question about your coverage, please use the contact form so that we can preserve your privacy. So next we'll move on to say a few words about our premium rate development process for this coming year. This portion of the presentation will be brief as we are still working on this and will be completed in early March, and we'll have more to say at that time. So on the next slide, you'll see our timeline for finalizing premiums for this year. We had an initial discussion about preliminary rates with our commission at our December 15th meeting. That discussion is based on information that we have at that time and entails us looking 6 months into the future, really a year and 6 months into the future, which of course involves some uncertainty. So last week we presented our commission with preliminary plan design changes, which we'll review with you today. Both the December and January meetings, you can find video of those on our YouTube channel. So our next meeting, February the 16th, will be the commission voting on our proposed plan design and then finalizing premiums for specific plans on March the 2nd. So that's the timeline that we're working with. So when we say, here's a little bit more information about our projections for next year. So when we say preliminary rates, what we're talking about is what the rates would be if there were no changes across plans or insurance companies, funding and member enrollment in each plan, a number of variables which we, over the subsequent months, work to nail down. The expected aggregate increase, this is really important to know, is an average across all of our plans, both Medicare and non-Medicare. So each specific plan offering through the GIC will have its own specific change to its premium, and that may fall outside of the average range that's noted here on this slide. Again, those are final numbers for each plan that we'll be determining in early March. So I want to draw your attention on this slide to the green boxes and the gray box below the arrows. At this point, as you'll see in the gray box, we are projecting an aggregate premium increase across all of our plans of 6.7%, but that is within a range of a possibility range of between 4 and 8% when we make our final decisions over the coming months. So while still more than we'd like to see, a 6.7% increase is smaller than what people who are purchasing insurance outside of the GIC are facing. You'll see in the yellow boxes above the arrows here that those increases range between 5 and 9%. So while we continue to outperform much of the rest of the insurance market, we still have work to do, and we will continue to do that to moderate these increases on your behalf. So with that said on preliminary rates, we'll move to the next slide and we'll start to review the results of our health benefits procurement. So those of you who follow the work that we do closely know that we have been at this work for quite some time. By way of background, we are currently in the 5th and final year of our contracts with our current vendors, and we are required by state law to go through this procurement process at least every 5 years to choose the companies that we work with. We spent, as is noted here, most of 2021 developing our strategic framework, gathering information, reviewing our data, talking with outside experts, talking with those that represent you, and engaging with our members as well. So this included the member preferences survey that we fielded last summer and which many of you participated in. If you did, thank you for that. In April of last year, 2022, we issued our request for responses, also known as an RFR. Then after reviewing the submissions that we received from the insurance companies and the pharmacy benefits managers, we developed our recommendations and presented them to the commission, and the commission approved both the pharmacy and health plan proposals, the health plans in October and the pharmacy benefit managers in December. So we're now finalizing changes that come out of that procurement so that we're ready to offer you coverage through the annual enrollment in April and May. And this is all for coverage that starts on July 1st of this year. But before we do all of that, these sessions are our way of informing you about where we are, decisions that we've made, decisions we still have to make, and to get your input throughout this process. So our three main strategic areas of focus here, we've been talking about these for several years, are to provide quality benefits to you that are as affordable as we can make them, to close gaps in health equity that are structural and long-standing challenges that we face, and to do our best to improve access to behavioral health services. As a result of the procurement, move on to the next slide, we will have some new companies to manage the pharmacy benefit for our active members and for our flexible spending accounts. If you move to the next slide, you'll see that here. I will talk a bit more about both of these changes in the subsequent slides, but you can see that for prescription drug benefits for active and non-Medicare retirees, we will be transitioning from Express Scripts to CVS Caremark. However, for those enrolled in Medicare plans who have CVS, the Silver Script program today, we are not making any changes there. That will continue. It is important to note here too that a pharmacy benefit manager, also known as a PBM, is different than a pharmacy. So while the CVS brand name does apply to both parts of their business, I want you to know that members who do not have access to a CVS pharmacy, if you're an active employee and you're concerned about this, you will, or if you have a preferred pharmacy that is not a CVS, you will still be able to use non-CVS pharmacies. The fact that the PBM is changing, that manages the whole benefit, does not impact your ability to use pharmacies that are not CVS pharmacies. And then under flexible spending accounts, commonly known as the FSA and the HSA, we are transitioning that benefit from Benefit Strategies that you will be familiar with, now called Avaya, to a company called Task. Very strong company with a lot of experience managing these programs, and we are working closely with them to make sure that this changeover is as seamless to you who are enrolled in these plans as possible. That will include a claims runout and grace period during that transition that you'll learn about more in the coming months. So now I want to move on to plan design changes that we're making for our active medical plans. So the next graphic should look familiar to you. These are the current plan offerings for active and non-Medicare retiree members. I want to note a few things as a result of either merger or rebranding by our companies. There will be some changes, but all of the incumbent companies, all of those that we work with today, did submit bids through the procurement, and we chose to continue with all of them. So that's good news for continuity, but there will be some changes that I want to walk through with you. So on the next slide, here are kind of high level the changes, and we'll touch on a few of these in more detail. And these are, again, changes that, if approved by the Commission, will become effective on July 1st of this year. So the first one, for residents who live outside of the 6 New England states, we will be offering a new plan. This is a PPO plan from Harvard Pilgrim Healthcare. This will replace Unicare Basic as an option for members residing outside of these states. There will also be a significant change to the premium structure for those who are currently in the Unicare plans that include the CIC, which I think members will like. So we'll go into more detail about that in subsequent slides. There will also be some minor changes to Unicare copays in an effort to really standardize them with the other plans that we offer to New England residents. Third, Always Health Partners has recently changed their name again, this time to Mass General Brigham Health Plan, and we will be making, we'll have to make some additional changes so that we can make sure that it's available to everyone in Massachusetts, not just in Eastern Mass. So this, I think, is more options for folks who live in the western part of the state. As many of you know, Tufts Health Plan is the last bullet here. Tufts Health Plan and Harvard Pilgrim Healthcare merged last year under the same parent company called Point 32. As a result of that merger, they chose to only offer Harvard Pilgrim for our active employee plans. So the Tufts Navigator and the Tufts Spirit program health plan will no longer be offered to GIC members. So here, and we'll talk a little bit more about this in a moment, I want to emphasize that the discontinuation of these two plans is based on a decision made by Point 32 as a private company. This is not a decision that was made by the Group Insurance Commission, but we're going to making every effort here to make sure that the transition from these plans is as smooth as we can make it. So that's high level. If you go to the next slide, you'll see that among the changes are some changes to plan names, specific product names that we offer. And this is really to help to mitigate confusion. It's always a challenge to change plan names, but we want to make sure that people understand where a plan has had some significant change, so that you can make an informed decision. So as I mentioned previously, the national plan for those residing outside of New England will be through Harvard Pilgrim Healthcare and will be called Access America. I also want to note that Health New England, our regional network for those residing in Western Massachusetts, that will not be changing. The broad network plans in the middle box here, available to those residing in New England, will be as follows. So we will have Unicare Total Choice. This is the successor plan to the basic Unicare Basic plan. So this is the indemnity plan that you're familiar with. This will also continue to be available to international residents. Unicare Plus will continue, as well as the other Unicare indemnity plan. We have a new plan called the Harvard Pilgrim Healthcare Explorer Point of Service Plan, which will also be available as a successor to Harvard Pilgrim Independence and Tufts Navigator, very similar to those plans, which will continue to require a member to designate a PCP. And then finally, Mass General Brigham Health Plan Complete HMO, which will be available to Massachusetts residents. On the limited network side, both of which are available everywhere except for Nantucket and Martha's Vineyard, those two plans will be Harvard Pilgrim Healthcare Quality HMO. This is really the successor plan to Primary Choice offered by Harvard Pilgrim and Tufts Spirit. And then we will continue on with the plan that you're familiar with, Unicare Community Choice, two lower cost options available to you. So I know there's a lot of name changes here. So later in this presentation, we'll have a slide that goes into a little further detail about which current plans are comparable to some of these newly named plans and how we intend to manage that transition. So here on the next slide, I'll go into a little further detail about the Unicare plan changes. First, as you know, two of the Unicare plans, Unicare Basic, which will now be called Total Choice, and Unicare Medicare Extension, have a premium component known as CIC. This is a member pay-all portion of your premium. This is really a statutory legacy feature of a plan that's become kind of outdated and redundant in the way that insurance offerings have evolved, plan design has evolved over the last several decades. So if you've or were an individual who selected either of these plans without the CIC component, that leaves our members at significant financial risk, since there's co-insurance that applies to certain services. So here we are recommending to wrap in the CIC premium component going forward into the overall premium for the plan for those in the total choice and the Medicare extension plan. So what this means is that the Commonwealth of Massachusetts will absorb this additional premium using the appropriate rate based on the member's date of hire that already applies to your premium. So for example, the state, if you're a member with less than 20 years of service and the state covers 25% of your premium, then that would now apply to the CIC portion of your premium. If you're more than 20 years of service, then 80% would be covered by the state. So this, I think, is a real benefit to our members and richer coverage here. So this change will harmonize GIC coverage across both of these Unicare plans and will both include that CIC coverage. So we're really excited about this. Moving on to the next graphic, we have a few other changes to Unicare plans aimed at standardizing copays across all of our plans in the GIC. The first will apply to outpatient copays for the Unicare plans. This will be a $150 copay for eye and GI services, gastrointestinal services when they're received at ambulatory surgery centers, and a $250 copay for all other outpatient services. So what we're doing here is making the copays for these Unicare plans the same as all the broad and limited network plans that the GIC offers. So we're driving towards greater consistency here. Additionally, Unicare Total Choice will have a $45 copay for all specialty office visits. And lastly, Unicare Plus and Community Choice will have the same copays for PCP visits as all other GIC offered plans. We will summarize these changes in a moment. On to the next slide about Always, again, changing their name to Mass General Brigham Health Plan. This is a plan that's been offered by the GIC for a number of years. A few years ago, they changed their name from Neighborhood Health Plan to Always, now to MGB Health Plan. And these changes are made by this health plan. These are not changes driven by the GIC, but this MGB as a private company. In addition to the name changes, over the last several years, this plan itself has changed quite a bit. While they used to be a regional plan offered mostly in the eastern portion of the state, they have significantly expanded as a company to where they now reach all of Massachusetts. It also used to have a lower premium compared to other plans offered by the GIC. They now are pretty comparable to other plans offered through the GIC. So with these changes within the plan, our plan designs need to account for all that change. So we are making a few adjustments here. First, I think the good news is that the plan will be available to residents no matter where you live in Massachusetts. And we also want to make sure that we have aligned incentives across the GIC population, a theme I think you're hearing throughout this presentation. So we're applying a higher cost sharing as it relates to providers and facilities that are more expensive to align with the GIC's approach to tiering copays across our plans. So this will mean that individuals who want to stay in this plan and continue to see high-cost providers, there will be a higher copay depending on where you seek your care. And you'll be able to see the new copay structure for this plan on the table here. So that's the detail of each of the changes that we're making in plan design. The next slide will summarize these changes that I've discussed. I would invite you, sort of a lot to digest here, so I'd invite you to spend some time with this after the session is over and as you prepare for annual enrollment. You'll see across the top the companies that the Commission approved in our October meeting. The chart below shows recommended changes to plan names and copays, changes that are highlighted in yellow. And here you can see those changes. So on the next slide, again, there's a lot of information on it. I'd invite you to spend some time with this after the session. But this shows how our current offerings transition to our recommended new offerings to the Commission. So I want to assure you that members, everyone who currently has coverage will continue to have coverage. We highly recommend, however, that members spend some time evaluating all your options and shop for the plan that really best meets your needs with some of these changes. If you do not actively select a plan yourself, we will automatically place you into the most similar plan, which is what is shown here. Again, we strongly recommend that you review the benefit guides that we'll share in March and check that the doctors and hospitals that are included in those networks meet your needs. So moving on next to, briefly, because there aren't major changes, our Medicare plan offerings. The first I discussed a little earlier relates to Unicare, which is that the Unicare Medicare extension members will no longer have to pay separately for the CIC coverage. We'll continue to have the same coverage as you do today, but the Commonwealth will essentially be absorbing its portion of the cost of that CIC add-on. Second, as a result of the 0.32 health merger, as we talked about on the active side, so we see on the Medicare side, the Tufts Medicare Complement Medicare Supplement plan will no longer be offered in fiscal year 24. We encourage those of you who enrolled in that plan to evaluate your options during annual enrollment. Again, members who did not actively select a plan will be automatically transferred into the Harvard Pilgrim Healthcare Medicare Enhanced plan, which is nearly identical. Lastly, I just want to note here that there will be no changes to the Tufts Health Plan Medicare Preferred plan. This is the Medicare Advantage option, and also no changes to Health New England Medicare Supplement plan. So since I've covered a lot of ground today, and I'm sure you still have lots of questions, just a reminder that you can submit them at any time during the Q&A function. I know that staff is actively responding to some of those. And again, some of those we will take out and address verbally, and remind you, if you have a personal or specific question, to use the member contact form. So as we kind of round out this discussion, I'd like to invite everyone here to another opportunity to engage virtually with the GIC ahead of the annual enrollment. On the next slide, you'll see that we're pleased to offer new annual enrollment sessions, which will be in the weeks leading up to annual enrollment. We will have 2 sessions dedicated entirely to retirees and 3 sessions for active non-retiree members. So these sessions will be very similar to the ones we're holding today in style. Of course, we will have more information and final decisions at that point, and we wanted to make sure that we were bringing those to our membership. You'll have the opportunity to ask questions via the chat and all of what we're doing here today. And then finally, a reminder that our annual enrollment, as I said at the outset, April 5th through May the 3rd, And with that, thank you for your patience and allowing me to walk through some of these details. As we transition to the Q&A, we have a slide with some additional resources that are available to you, which we will keep up on the screen as we go through the Q&A. So I want to thank each one of you for your attendance and your ongoing engagement. As I noted earlier, these sessions will be recorded and available for viewing on the GIC's YouTube channel, and the slide presentation will be available on our website, which is mass.gov/GIC. So thank you again. Best wishes to your family for a healthy and happy new year. I think I can still say that. It's not quite the end of January. So with that, turn it over, I think, to Emily, who can assist with question and answer for the remainder of our period.
Hi, thank you, Matt. Yes, I do see people who are raising their hands to ask questions, and I just want to remind you to please ask all questions in using the Q&A function, and we will pull questions from there to answer verbally for everyone to hear. And the first is there's been a lot of interest in the MyGICLink, and we have included a link to that to register for the link in the chat function. And the question is, how do I get a PIN to register on MyGICLink, and who should I contact to receive one?
I think that would be a good question for Paul Murphy on our operations team.
Thanks, Emily. For those of you that want to use the MyGICLink on our website, there is instructions on how to register for the portal, as well as how to resend a PIN. There are instructions. In addition, this week we started mailing out our annual benefit statements to those members. And on the back of the benefit statement is also instructions on how to register for the MyGICLink member portal.
Thank you, Paul. And I believe this next one will be for you as well. And this question is, are FSA benefits available to retirees?
The FSA plan is not available to retirees. It's only available to active employees.
Thank you, Paul.
Great. Thank you, Paul. And we have a question. Will prescriptions transfer directly from Express Scripts to CVS, or will members need to take action?
So this is a question I will hand over to Jim Rust, our CFO, who's been overseeing the procurement, and he may hand it off to members of his team for response.
Thanks, Matt. Yes, they should. And Janine, are you available? Do you have any other details on that?
So CVS will receive all files from Express Scripts, and so any PAs or medications that are on file for current members will be transferred over, so it should be seamless. Should there be any disruption to the formulary, there is a 6-month amount of time so that a member will be able to receive their medication and make any adjustments necessary in coordination with their provider. So we do expect a seamless transition.
Thank you, Janine. And we have the question, is it possible to continue with health insurance with no fixed address, as I will be working remotely during the year and traveling?
I think that's another good question for Mr. Paul Murphy.
Thanks, Matt. No, GIC will require that you have a primary residential address on file. That address determines benefits and health plans that are available to you. So we will require a permanent residential address on our records.
Paul?
We have a question about if a member's name or information is spelled wrong on their benefit cards, how should they reach out to correct that?
Yep. Another Paul question.
If your health plan has an incorrect spelling of your name, you should reach out directly to your health plan, and the health plan phone numbers are on the back of your ID card.
Thank you, Paul.
We have a question, a retiree question. Is my spouse who is on Medicare able to be part of my Health New England family plan for their supplemental?
Yes, if you are a retiree from the Commonwealth and you have Health New England, any member age 65 or older on your health plan is eligible to select a Medicare supplemental plan. You can stay with the Health New England Medicare supplemental plan, or you can choose another GIC Medicare plan. But your spouse is able to stay on if he or she is eligible for Medicare and you are retired.
And we do have a clarifying question about the portal, asking if the letter in the mail will contain their PIN number.
The letter in the mail does not contain their PIN number. When someone registers for the portal, the member will receive an email with their PIN number, but we don't send a letter. When they register, a PIN number is sent to the email that they're using to register for the portal.
And this is a more general question, asking if we could share some more information about what FSA plans are.
So I will take a stab at this and have others come in behind me. So this is an option for those enrolled in the active plans to set aside money, essentially a savings vehicle for individuals to use to pay for certain things. So copays, deductibles. There are a list of approved expenditures using this savings opportunity. You would essentially it essentially allows you to set aside money through a payroll deduction, which is why it's for active employees only, and be able to use that money. You'll have essentially a dedicated debit card for that account, which when you go to your doctor's office to pay a copay, you go to the pharmacy to pick up a prescription, and you have a copay, you can use the card for that purpose. And the real benefit, in addition to just ease of use and being able to manage your money as it relates to your coverage, it does allow you that tax benefit. So the contributions to your account happen pre-tax and lowers your overall tax liability. Anybody want to add, Paul, Jim, or anyone from Jim's team want to add to that? Those are the basic advantages as I know them.
No, that's correct, Matt. The advantage from the FSAs is setting aside money that you can be reasonably confident that you're going to be spending over the course of the year, and you set it aside on a pre-tax basis in order to realize those savings.
One of the other aspects of this that's good is that so when you enroll in the plan, you designate how much money you want deducted from your paycheck over the course of the year, and then they deduct it in those increments every time you get a paycheck. But the full amount that you elect for the whole year, let's say it's $1,000, $2,500, is available to you to spend on those qualifying expenses immediately starting on July 1st.
Yes, that's true for the medical plans, but not for the dependent care.
Correct. Thank you for the clarification. Yeah, and that's a good point too. I was talking generally about the health FSA. but we also have it available for a variety of dependent care, qualifying expenses, childcare, and that sort of thing.
Right. I think that's a great distinction, Matt. And we did just receive that question asking if TASK will provide both FSA and health savings account HSA benefits.
Yeah.
We,
And the answer
the
to that is
GIC,
yes.
well, just to clarify, the GIC does not have an HSA compatible health plan. There is the healthcare savings account, which is the formal name for the medical FSA. And that, along with the dependent care plans, will both be offered by TASK, and you will actually be able to use the same debit card for both accounts if you participate in both.
Thank you, Cameron. And this is slightly similar to a question that was earlier asked, but asking if active employees on Medicare can have FSA.
No. If you're an active employee, yes, you can participate in an FSA, regardless of whether you have one of our active plans or Medicare coverage, but you must be an active employee and not a retiree in order to participate in the FSA, because they are funded completely by payroll deductions.
Thank you, Cameron. Now shifting gears, we have a question about the Unicare change and how this will impact so-called snowbirds who may receive healthcare in another state for several months per the year.
Yeah, it's a great question, which I'll turn over to Paul Murphy, our operations director.
What we do have is for members that reside outside the health plan service area temporarily, let me put this, members residing in New England should always use their primary residential address to receive the maximum benefits from their plan. If you're traveling or residing temporarily outside of the health plan service area, you don't need to update your address with GIC. And you can contact your health plan for any outer area benefits or when traveling, what the benefits are directly. But GIC does not require you to change your address if you're just perhaps going to Florida, Arizona temporarily. You should keep the primary residence as New England. For those members that are outside, permanently reside outside of New England, the only plan that will be available come this annual enrollment will be the new plan, Harvard Pilgrim Access America.
Thank you, Paul.
Thank you, Paul. And we have a question about the change to CVS, asking if we have most of our prescriptions if we fill most of our prescriptions at a pharmacy other than CVS, will that we still be able to?
The answer is yes. Again, as I noted in the presentation, moving the PBM to CVS Caremark doesn't change your ability to fill your prescription at a participating pharmacy, whether it's CVS or not CVS. If there's any additional clarification that Jim or anyone else wants to add, perhaps Janine, please do so.
I think you captured it. You'll be able to fill prescriptions at other pharmacies as well. It doesn't have to just be CVS.
Thank you.
Thank you. And we have a question. I have a dependent that goes to college out of state, and I have the Unicare CIC plan. Will the Harvard Pilgrim Access America plan be the one I need to switch to now?
That's probably a question for Paul Murphy again, or perhaps someone on Jim's team.
I can chime in, Matt. If you, as the member, reside in New England, you're eligible to keep the plan that you currently are enrolled in. If you have dependents that go to school or live outside of the New England area, then the plan that you are enrolled in, living in New England, say it's Unicare Basic, will continue. and that member will have access to any out-of-network benefits that the plan offers. If you are living within New England and have dependents outside of New England, the plans you have today will continue and the benefits stay the same. It's only when you, the member, change your address to a permanent residence outside of New England, then the plan becomes the Harvard Pilgrim Access America.
Thank you, Paul.
Thank you, Paul. And we have a question. My daughter will be turning 26 soon. Will the GIC send notification regarding their coverage ending, and what steps should they take?
Yes, for any dependent who is turning 26, the coverage on GIC ends the end of the month in which the dependent turns 26. GIC will send a notice to the member a month before the coverage expires, and the member will be able to elect COBRA benefits if they choose. It's totally an option, but COBRA is available for 36 months from the coverage ending date with GIC. We often also recommend the Mass Health Connector to visit their website for additional plans that may be available other than COBRA.
Thank you, Paul. We have another question about FSA and the change of vendor. Does the new vendor replacing benefit strategies have the same yearly grace periods? And can you carry forward any unused balance of FSA funds?
Yes, the grace period will remain the same. Any remaining balance that you have from the current fiscal 23 plan year will roll over and be available for use through September 15th, just as it is currently. And you will have until October 15th to file claims against your fiscal 23 balances, although the date of service must be before September 15th of this year.
Thank you, Cameron.
And we did receive a question we may want to clarify on who will administer the transportation benefit.
That will remain, that benefit is the responsibility of the comptroller's office. The GIC does not administer the transportation or parking benefits, although it's our understanding that those benefits will remain with the current vendor, who is also Benefit Strategies, our current FSA vendor.
Thanks, Cameron.
We've received a number of questions asking what members who are in the Tufts Navigator plan, which as a result of the .32 health merger will no longer be available to active members, what those members should do.
Well, first I would, as I mentioned several times throughout the presentation, strongly encourage folks to evaluate other options that are available in our health plan portfolio. So for the successor plan that we are introducing for fiscal 24 is Harvard Pilgrim Healthcare Explorer point of service. As I mentioned, it is very similar to both the Harvard Pilgrim Independence Plan and the Tufts Navigator Plan. So if members did not actively choose, it's the Explorer plan from Harvard Pilgrim that they will be default enrolled into. But you also have available other broad network options. You have limited network options. So this would be a really good year to, during annual enrollment, really dig in and figure out which best meets your needs.
Thank you, Matt. We received the question, I'm a retiree. I am turning 65 soon. Will the GIC send me information on applying for Medicare?
Another one for Mr. Paul Murphy.
Let me give you a couple of scenarios on the Medicare. Maybe it'll help alleviate some of the other questions we get. If you are a member covered by GIC and you are retired 3 months before your 65th birthday, you and or your spouse will get a letter from GIC explaining the coverage options available to you, and GIC will require you to enroll in a Medicare supplemental plan. So that letter will go out 3 months before your 65th birthday, explain all of the options, and it will also require that you and or your spouse enroll in Medicare Part A and Medicare Part B with Social Security. You do not need to enroll in Medicare Part D, the prescription drug benefit, because all of GIC plans have adequate coverage on the pharmacy side. So there's no need to enroll in the Medicare Part D plan. If you are over age 65 and retire, you will also get a letter upon retirement from GIC explaining the same options available to you to pick a GIC Medicare plan, and you will also be required to enroll in Medicare Part A and Part B at that time. If you are not eligible for Medicare Part A or Part B, GIC will require proof from the Social Security Administration that you are not eligible for Medicare. Some people have never paid into the system. If that is the case, then GIC will allow you to continue in the plan you have after age 65. For those employees who are going to continue working after age 65 and are covered by GIC, GIC does not require you to enroll in a Medicare plan. You can defer the Medicare enrollment as long as you, the state employee, continue working after age 65. So we get a lot of questions regarding Medicare. I hope that helps with some of the questions that people are sending.
Thank you, Paul. And we've received the question, will GIC be offering in a family plus one plan, an individual plus one family plan?
Sorry, I'll take that one. We've had this request many times, and we have evaluated this option. And the modeling that we have done suggests that it would be quite disruptive to the GIC membership. You know, this is an area that we will continue to evaluate whether moving in this direction provides a significant benefit here, but what we have heard the interest in this plan. If any of my team wants to add to something on that, please feel free. I think the short answer is in the short term, we're not anticipating adding this additional plan type.
And there is a question whether the Harvard Pilgrim Access America plan for dependents living out of state, if they will be considered visiting out of network when they need to use their benefits.
So if they're accessing their benefits, well, maybe I'll, rather than stumble through this, I'll hand it over to either Jim or Cameron to talk about that.
I'm sorry, what was the question?
When using the Harvard Pilgrim Access America plan for dependents who live out of state, will they be considered out of network, visiting out of network?
There, well, eligibility for the Access America plan depends on the state of residence for the subscriber. So whichever employee or non-Medicare retiree is actually getting the coverage through the GIC will determine whether or not they're eligible for the Access America plan. If you are covering dependents anywhere else in the country, they will have access to a very large comprehensive network of providers. You will pay less at the point of service by using in-network providers. Harvard Pilgrim has built this network in partnership with United Healthcare, which is the largest insurance carrier in the country. And it is the broadest possible network of providers that our members will have access to.
Yeah, so it's a network plan, but it is a national, very broad network, as Cameron said. Now there may, you will have the option, because it is a PPO plan, you will have the option to go out of network, but it is not a network that is, developed for the New England population. It's really for those who live outside of New England. That's the way we've designed it to be that way.
Thank you. And I want to ask if we can move back to the slide that shows the next annual enrollment sessions. We've received a lot of questions about when members will have the opportunity to engage again and receive more information. So I just wanted to put this here so that people can review it. And we've received another question. Will retirees with a Silver Script card receive a new CVS Caremark card after June 30, 2023?
Yes.
Sorry, Cameron said the answer is yes.
Yeah, active members will receive a new prescription benefits card from CVS before the start of the new plan year on July 1st.
And does that applies if you're on Silver Scripts as well?
Silver Script, no, you should not need a new card.
Okay, yeah, that was the question, I think, specific to Silver Script. Yep.
Thank you, Cameron. And we've received a number of questions about when there will be more information available about these changes so that members can make comparisons and evaluate all of their options. And I do want to say in the chat, again, we have the link to register for the portal, the MyGICLink portal, where you will receive information on these sessions here, and you can view your benefits at any time. And Matt, I don't know if you'd like to add anything else here about benefit guides and the other materials that will be available.
Yeah, others can talk about timing of this, but we will, as we always do, be sending out benefit decision guides that capture all of your options and will be a really go-to source for all the information you need for annual enrollment. I'd have to ask somebody else to weigh in on when we anticipate that those will go out, but I think generally we should expect them, as we've gotten them before. We'll get them out in plenty of time for you to evaluate. And then, of course, these annual enrollment sessions will be just another opportunity to engage with us. So I would encourage folks to use all of those tools available in addition to the portal.
Yes, Matt, I would also add that in addition to these sessions, the guide is a useful tool that will be posted online. Our website is also a very useful tool. Prior to annual enrollment, that will have all the updates and all of these changes posted there. Retirees will continue to receive a benefit guide at home, listing all of these changes that are going to take place. Those books will be sent out starting the first week in April of annual enrollment, so that members have it on time before the start of annual enrollment. If you're a GIC coordinator, we will also be putting together a coordinator deck so that you can share these changes with employees in your agency. So we have a bunch of tools that we'll be putting out there right before annual enrollment. And of course, the member portal, in which you can shop and do a plan comparison online directly in the portal of all these different plan offerings as well.
Thank you, Paul.
Thank you, Paul. And there's also been a number of questions here about when the materials from this session will be available or if they will be available. And I do want to confirm that these will be posted to our website. There will be a recording of this posted to our YouTube channel, where there are also recordings of our commission meetings if you ever wanted to view them. We will also, the deck is also already available online, and I will have someone drop that link in the chat here if anyone would like to review the deck at their own leisure. We have a question now about the buyout program, asking if it will be available again, and if so, could you review how it works?
Another question for Paul.
The buyout program, the next opportunity will be during the GIC's upcoming annual enrollment. The buyout allows the member to cancel their GIC coverage and buy out. GIC will allow a member to receive a check monthly for 25% of the full cost premium for 12 payments. So the buyout is only available during annual enrollment this year. Coverage ends June 30th, and GIC will send the member a check, or it'll be included in your paycheck, 25% of the full cost premium, but only for a period of 12 months. After annual enrollment, the GIC has a fall buyout, which usually takes place in the month of October, where members can cancel their coverage as of December 31st and start receiving the 12-month check starting January of 24. We only offer it twice a year. Those are the only two buyout periods. Just to clarify, because we also get a lot of questions, new hires, we do not have a benefit for a member who doesn't enroll as a newly hired state employee. There is no buyout option. This was legislation that was passed in 1991 and allows people that currently have GIC coverage to buy out during annual enrollment or in the fall.
Thank you, Paul. And we did receive a follow-up question to the when information in the benefit will be distributed, asking if active employees will receive a booklet of information in the mail this year.
We do not send booklets directly to active employees. We post it on our website. The portal will also have a link directly to the online guides for all members actively at work. We only do it for the retirees. We mail the guide. So we send it through the GIC portal, in which we'll have a link to the active online guides. It'll be available on our website immediately prior to annual enrollment. And we'll be sending that same link to the GIC coordinator at the agencies to share with employees in their agencies.
Thank you, Paul. And we have a question about specialty prescriptions. Will we still be using, the GIC still be using a credo for, if I'm saying that correctly, for specialty prescriptions?
I think that would be a good question for either Jim Rust, our CFO and Chief Procurement Officer, or Janine on his team.
We would be using the CVS specialty.
So that will be changing with the new PBM relationship then.
Yes, the Credo is part of Express Scripts, so it would change over to CVS.
Thank you.
There are quite a few questions about equivalent plans. If we can move back to the slide that shows what that would be. And Matt, if you want to say a few words here again about the process with all of these changes and that how we encourage members to approach them.
Yeah. So first and foremost, we want to make sure that there's not a scenario in which someone who doesn't act loses their coverage, right? That's the kind of first and most important point for folks to take away. But because of the number of changes that we are instituting here, many of which result from changes on the part of our carriers and how they're operating their business. This is a really good year to get engaged and, with all the tools that we've been talking about here today, evaluate the plans, evaluate the cost sharing features of the plans, really evaluate the networks of the plans, depending on what your situation is, and make an active choice. We really strongly encourage that. If you do not, however, in order to make sure that you don't lose coverage, we will place you in the most comparable plan that exists on our portfolio. So that's what this slide lays out. You'll see sorry, let me get it so I can see it a little more clearly. You'll see, the target population. You'll see the existing plan portfolio on the far left that exists today. You'll see who the population served by the different plans are. And then you'll see in that middle FY24 plan column, the plan to which you will be enrolled if you do not act. And then on the far right, you'll see the types of changes that that come from moving from that legacy FY23 plan to the FY24 plan. So for instance, if it's Tufts Navigator, you'll be moving to Harvard Pilgrim Explorer. The plan is almost identical, so you'll experience mostly a name change. But the other, some of the others include other changes. So the Always Health Partners plan, as we noted, going from a regional plan to a statewide plan will have a different copay structure. So you'll want to be really aware of what some of those copay structures are depending on who your provider is. So this is a great year to really dig in and evaluate your options.
Thank you, Matt. We have another question from retirees about what the process is for transferring from an active plan to a retiree plan for those retiring after the age of 65.
I'm sorry, can you repeat that, Emily?
What is the process for transferring from an active to a retiree plan for those retiring after the age of 65?
Another good Paul Murphy question.
Sure. There are actually two things you need to do, two options available to you. First of all, if you plan on retiring, in order to change your status from an active employee with GIC benefits to a retiree with GIC benefits, GIC needs a form. It's called a GIC Enrollment and Change Form 1. On that form, there is a section about retirement that asks several questions about your life insurance and date of retirement. GIC needs that form to transition you from active status to retirement status. You may also submit your retirement information through the GIC member portal directly. There is a qualifying event labeled retirement in which you can answer the questions, and we will transition your benefits from an active employee to a retired employee. One thing to keep in mind is that when we do transition you, GIC will bill you for a period of 3 to 4 months from the time you leave state service until you receive a pension check. Once you start collecting the pension check, GIC will coordinate changing you from a billing to a deduction status. So it's very important that members continue to pay the bills that GIC send them after you leave state service to avoid uninterrupted coverage.
Thank you, Paul. And now we have the question, will the GIC consider removing the waiting period for new hires and members?
Yes, I'll take that one. So this is, there's a feature, for those who are not aware, there's a feature of our eligibility whereby there's a waiting period of 60 days before the coverage becomes effective after your date of hire. This is, we understand that it presents a hardship for new hires. We are interested in shortening or eliminating the 60-day waiting period. We have significant resources at the agency dedicated to figuring out a path to do this. It is a complex project for us, and it involves working with a number of other state agencies. And so this is not a change that we can make unilaterally. So that makes it a more complex project for us. But we are working on it. There are administrative reasons why that it exists, but I'm eager for us to find a path to lessen this burden on the part of new employees.
Thank you, Matt. And we're still receiving a number of questions about residency, such as if members will be able to access Harvard Pilgrim's Access America while we're working remotely and traveling, but maintaining a Massachusetts residence.
No, they would not.
Yeah, this question of residence is one that we've spent a good deal of time thinking about. For those of you who have kind of some of these unique circumstances, I'd encourage you to be in touch with us as you contemplate what your options are. This would be one for you and for us to keep a close eye on. And I guess I would note that there are, outside of the GIC, there are a variety of sort of telework policies, or there is a telework policy for state employees that is important for you to understand so that you're in compliance with that. So that, again, completely outside of GIC and your benefits, you'd want to be aware of what those requirements are. So that I would direct you to your agency, or to, if you're a state employee, to the Human Resources Division.
Thank you, Matt. And we have the question, will there be any changes to the life insurance and LTD benefits?
There are none, because we did that procurement and made changes to that program, I believe it was last year. So that is not on our cycle, so no changes there.
Thank you. And we have a question about what coverage should be considered for non-resident retirees. Paul, if you would like to take this one.
Sure. Actually, viewing the chart that's up on the screen right now, if you are retired and you reside outside of the 5 New England states on the chart here, if you have the Unicare basic plan with or without CIC, we will move you to the new plan, Harvard Pilgrim Access America, during annual enrollment, or unless, we will automatically transfer you over. But I also want to clarify, for those retirees that are in the Unicare Medicare extension plan, you can still maintain that plan outside of New England. The change here only applies to the non-Medicare plan, Unicare with or without CIC. The Unicare Medicare extension plan for residents outside of New England continues, and there's no change there other than the change that Matt referenced about rolling up the CIC into the premium.
Thank you, Paul. We've had a number of questions on if we will be doing any in-person health fairs or sessions ahead of annual enrollment.
So we are not doing in-person benefit fairs this year. I think we're being mindful of the fact that the COVID-19 continues to be a reality in our life, and we want to be able to protect people as best we can. There will be, as we have in past years, information about each of the carriers and plan offerings on the GIC website. And I would encourage members who have carrier-specific questions to review that material. And really, at the end of the day, be in touch with the health plan. Again, there'll be information on how you can contact them on that portion of our website. So we're trying to strike the right balance here so that we can make sure we keep people healthy and safe.
Thank you, Matt. And if we could go to the slide one more time showing the annual enrollment sessions. We have a number of sessions asking when there will be more information regarding plans, co-pays, how to view side by side. And these will be the sessions. And again, we have 2 offered for retiree specific. As you can see, we have a lot of retiree questions, and then 3 that are being offered for active employees and non-retirees.
Yeah, I think the retiree focus sessions will be a great opportunity to learn more about that. We'll probably have a dedicated portion of our agenda to that. As folks who are veterans of these information sessions, you know that we've had those in the past in these January sessions with so much to cover on procurement and plan design changes. We just didn't have the ability to do that today, but strongly encourage folks to participate in those sessions. We also do have a brief video about turning 65, which can be accessed on our YouTube channel and through our website, which explains some of the key decision points. This is, when you go from active to retired status, as I think is probably clear to everyone, there are a variety of important steps that are important to get right. So we'll dedicate some time in March to these, but just strongly encourage folks to be in touch with our operations unit. We have a dedicated team on retiree issues that has been working with these issues for a long, long time and can be very helpful to you. So it's important to get right. So please let us know how we can help.
Thank you, Matt. And we have a question. Is there a plan designed for Massachusetts residents who have students or dependents who live out of New England?
Let's say someone can correct me if I get any part of this wrong, but all of our plans have out of area coverage, right? So, and that applies to you and it applies to your dependents. That is not a new feature. That's a feature that is common to all of our plans and common just in general in insurance coverage. So that will not change. That will continue to be a benefit for dependents that live out of area. Did I leave anything out there important?
Yes. If I may
Go ahead,
just add,
yeah.
There is emergency coverage on all our plans, but an HMO such as Health New England does not have out-of-network coverage in general. So that would not be a plan you'd want to enroll in.
Right. Good point. So a point of service POS plan would have out of area coverage. A PPO plan would have out of area coverage. But the HMO plan, so that would be the Mass General Brigham formerly Always Plan, and the Health New England Plan, both HMO plans.
And I think this will be our final question, as we're coming up on time, and we can even move to the slide if needed, but we had a question about timeline and when the commission will be voting on the final plan design and rates, and when those decisions will be final.
Sorry, can you repeat that, Emily?
Yes, the question was about timeline of when our commission will be voting on the final plan design and rates recommendations.
Yeah, so we, as I said, presented the plan design changes last week to our commission. Our February meeting, I don't see the date on here, February 15th, if my memory is
16th,
correct.
Matt.
16th, thank you. February 16th, which folks can, we'll be live streaming that on YouTube as we do all of our meetings. You can view that discussion. So that would be the vote on plan design changes, and the vote on final plan specific rates for each product would be our March 2nd meeting. I believe it's March 2nd commission meeting. So that's the point at which we'll have all of our decisions made.
Thank you, Matt. And I think we're at time now, so that will be our last question. We will continue to follow up and circulate a frequently asked questions document post to our website following these sessions. And I will hand it back to you, Matt.
Great, thank you. And thank you to all of our members for tuning in. As has been the case for several years now, the interest in these virtual sessions has been tremendous. Many multiples of our members participate in the virtual versions as opposed to the older in-person versions. I hope this has been helpful to you. I would, draw your attention to the links that we've posted, I believe in the chat here, about turning 65, about all the contact forms where you can be in touch with us, the additional information sessions. So information on all of this you can find in the chat here and on our website. We really want to continue to serve you well, make sure you're well informed, provide you the tools that are necessary to make insurance decisions that meet your needs. But we thank you for continuing to be engaged with us throughout this process. And thank you again for joining us.